Examine the oral cavity, the pharynx, the esophagus of the horse, and summarize the findings. Interpret the gastroscopic findings of the horse. So the signs of oral disease are quitting, which is when the horse stores bolus of food in the side of its mouth or drops food after a few bites. Swollen face, salivation, oral discharge, nasal discharge, halitosis, head shaking, and weight loss and painful chewing. Without physical examination of the oral cavity, look at the external palpation of the cheeks, inspectation of when the tongue's out, and the use of mouth gag is also. With sedation, you can use a detailed examination, use a mouth rinse, you can use an endoscopy of the pharynx, esophagus, guttural pouch, and nasogastric tubing for examination of the stomach. So what to examine the oral cavity? The mucous membranes, look for abnormal odor, look at the teeth, the tongue, the salivary glands, so the parotid gland, the mandibular gland, the sublingual gland, and the buccal gland. And you can look at the pharynx and the esophagus as well. So dysphagia, this is difficulty in swallowing. The classifications are based on the location. So prepharyngeal, so signs are quitting and drooling. The possible causes are abscess and somatosis, and teeth and jaw disorders, such as fractures and loose incisors. The pharyngeal, the signs are pharyngeal dysphagia, the signs are decreased swallowing reflex and gagging, and neck extension to attempts to swallow. The possible causes are neurological disorders. And postpharyngeal, so this is esophageal, the signs are gagging, neck extension in attempts to swallow, and the possible causes are esophageal obstruction and neurological disorders. So the neurological disorders, so the trigeminal is for the mastication muscles, the facial nerve moves the lips, and glossopharyngeal, which is 9, vagus 10, accessory 11. These are for the movements of the soft palate, pharynx, and larynx. The hypoglossal, which is number 12, this is for movement of the tongues. The diagnosis for the trigeminal, palpate the masseter muscles and look for atrophy, and then pull the jaw downwards and examine the chewing motions. For the facial nerve, cranial nerve 7, so trigeminal is 5 and facial nerve 7, look at the palpable reflex and see the drooling lips. For the swallowing reflex, look at cranial nerves 9, 10, 11. Give watering and feeding to the horse, passing through a nasal gastric tube. And the laryngeal abductor response, this is the slap test. In a healthy horse, the contralateral arytenoid adducts briefly. And use observation whether the food or water or saliva returns through the nose when the horse drinks or eats. And the tongue, pull out hypoglossal 12, pull the tongue slightly apart. Pull the tongue out tightly and observe the movements. Look for atrophy, pinch it with a hemostat and look for reflex. Pull the tongue out to one side and look for retraction. And the common disorders that cause dysphagia are botulism, rabies, tetanus, and glottal pouch mycosis. The management is very specific. It could be anti-inflammatories and antibiotics in the case of an abscess. Dry hay is not recommended. Pellets are better. And in extreme cases, nasogastric tube feeding is important. So stomatitis is inflammation of the oral mucosal membranes, and glossitis is inflammation of the tongue. The causes can be foreign bodies, ulcers, viral infection, bacterial infection. There are salivary glands at the parotid, mandibular, sublingual, and buccal. So parotid, mandibular, buccal, and sublingual. The examinations are inspection, palpation, ultrasound, and needle aspiration. And examination of the pharynx. So inspection, video endoscopy using a treadmill, ultrasound. Pharyngeal lymphoid hyperplasia, so the nasopharyngeal roof and the dorsal pharyngeal recess. It's common in young horses. The result is a local immune response and dorsal displacement of the soft palate. So the soft palate moves dorsal towards the epiglottis and causes obstruction of the airways. The clinical signs are vibrating during expiration and when the horse breathes through its mouth. This is not normal, it's a nose breather. And the cause is guttural pouch inflammation can lead to neuropathy of the pharyngeal branch of the vagus nerve. Management, so tongue tie, a caudal retraction of the tongue, elevates the soft palate. Placing the tongue tie during exercise also helps. Training young horses and giving NSAIDs for pharyngeal muscle weakness. And using a rubber band to ensure the nostrils are open for air intake. And you can also use surgery, a laryngeal tie forward. And for a laryngeal collapse, you can have a rostral pharyngeal collapse. This can lead to dorsal displacement of the soft palate, or you can have a dorsal and nasopharyngeal collapse. And the esophagus, examine expectation, palpation for foreign bodies, nasogastric tubing, endoscopy, radiography, and blood chemistry like hyponatremia. And the predilation sites are the cervical part, the thoracic part, the base of the heart, and the gastric part. The types are intraluminal like foreign bodies and extraluminal like tumours. The obstruction, So this can be caused by feed, like impactation of straw and hay. The clinical signs are dysphagia, extended neck, salivation, too much, and bilateral frothy discharge and gagging. The complications can be aspiration pneumonia and esophageal rupture. The management is sedatives like Buscopan and xylazine, and the passage of the nasogastric tube can also help with obstruction or an esophageal lavage. Esophagitis, this is inflammation of the esophagus. It can be caused by gastric reflux. And the gastroscopy preparations: 12 hours before fasting, set it and give xylazine. Inflate the stomach with air and decompress it after. And the curvature major has a non-glandular part. It's pink and no, it's a white non-glandular part, and the dorsal pink glandular part are separated by the margo plicatus, and this is where ulcers are found on the margo plicatus.